Hi everyone, thanks for taking the time to learn about Dulcian Health's chronic care management solution for Athena Clinicals. I'm Mike Rubin. I am the COO at Dulcian Health and I'm excited to introduce our product to you. So let's get started. Dulcian Health is a 22-year-old company and this is our second product we've developed under the Athena Health MDP program. So real quick, chronic care management or CCM, it's a Medicare program. It was introduced in 2015 and its ultimate goal is to keep patients out of the hospital. It's really designed to reimburse the practices for the time that they spend caring for their chronic diseased patients. And it's the time that they spend in between their face-to-face visits. So it's that non-face-to-face time that's now billable under CCM. Now, the nice part about CCM is that all of your practices are already providing this non-face-to-face care. The problem is they're just not getting paid for it. So what's in it for the practice? Well, the practice can now bill Medicare under CPT code 99490, and it's somewhere around $42 for every CCM enrolled patient who receives 20 or more minutes of CCM care. Now that's $42 per patient per month, which for a typical practice could translate to around $100,000 per provider per year. That's essentially free money because most practices are already speaking to their patients on the phone or via telemedicine. They're reviewing their charts, they're reviewing their care plans. Someone in the office is calling in a prescription, they're on the phone with the insurance company, they're doing some prior authorization, and all of that counts towards the 20 minutes. So let's jump to our product. Our product is the chronic care management solution for Athena Clinicals, and it's fully integrated into Athena Clinicals. So there's no interruption into your practice's workflow, and there's no need to toggle in between AthenaNet and, say, some other system. All of the work is done right inside of Athena. Let me show you what I mean. So I'm going to pull up a patient here. This is Susan Doe. She's a 72-year-old female. She has 3 chronic conditions. And you'll notice down in the lower right-hand corner is our product. This is the DH-CCM timer. And what it's done is it's gone out and it's taken a look at this patient's chart. And it's determined that this patient is indeed enrolled in your CCM program. It's done a bunch of other tests to make sure that it satisfies all of the Medicare requirements. And once it's decided that, yes, this is indeed an event that can be timed and will count towards the 20 minutes, our timer pops up and it just sits down there in the lower right-hand corner and it ticks away. Now, one of the requirements for billing for chronic care management is that you have to tell Medicare, you have to document what it is that you're doing. It doesn't have to be a long, elaborate definition or explanation, but simply coming in here and checking off that you ordered some meds, you were reviewing some labs, and maybe you were doing a care plan review. That's it. That's the level of documentation that's needed. At this point, you can minimize this. You can slide it wherever you want around the screen. I like to slide it down here out of the way. And now you have full control over Athena. You can navigate anywhere you want. I will point out this, that when a patient is enrolled in chronic care management, if you go down to their insurance section, under chronic care management, you'll see that this patient is indeed enrolled. So that's it. That's the nice part about this software. There's never any time that's lost because our software makes sure that it does all the checking for you. The practice isn't wasting its time looking up, well, are they enrolled, sliding down here and looking to see if they are enrolled. You've also got to go and make sure that they don't have a face-to-face appointment today. There's a number of other things that our software takes care of for them. So again, it sits down there and that's it. When you're done and you navigate to the next patient, our timer stops. It saves all of the information. All of that information is later if they're ever audited. But that's all stored away for them. And if the next patient that comes up is a CCM enrolled patient, then a nice fresh timer pops up and they do it again. So again, easy and convenient, no lost time at all. You just navigate from one patient to the next, and our software determines whether or not the timer is supposed to pop up. We do have a couple of buttons down here. We have a cancel button if you're looking at the wrong patient. We've got a pause button. Obviously, if you get distracted, you've got to step away for a second. You could pause it, click resume, and if you're all done, you can click on stop. Next thing I'm going to show you is the care plan. This is a huge part of chronic care management. One of the regulations say that the care plan has to be available to the care team on a 24/7 basis. It also has to be available to the patient on an as-needed basis or on a as-requested basis. Now, what's happening here is that our software, again, is going out to Athena. It's gathering all of the information for this patient, all the current information that's available in AthenaNet for this patient, and it's building this care plan. This is all built into the software. On the left, they can pull up any historical care plan, and on top here, it's the March current. Now it says current because this is the one that is still pulling the most recent data out of Athena. At the end of the month, we archive it, and that's what the rest of these are. So I'm not going to give you a lesson on what's in the care plan, but essentially we've got all of their history that was gathered during their last 3 appointments. We have a lot of forward-looking information in their goals. We have all of their medications. We have all of their counseling and what the practice is doing to make sure that they stay healthy and they stay out of the hospital. Anybody that they need to reach out to, health proxies, etc., social services. And a lot of this information is coming over from Athena. Their care team, again, all comes over from Athena. Down below here is all of their chronic conditions. In this case, our patient has 3 chronic conditions and 1 acute condition here. And then, again, we pull all of the social history over from Athena. And then finally, if this patient had any labs in our system, then they would be reported down below that. I said that you can download it. You would click here to download it. You can click here to print it. We have a medical portal, which is different than the Athena patient portal. This is really designed for caregivers outside of your practice, so that if somebody, a cardiologist who's outside the practice needs to get access to this information, they have that available to them. We have an edit button. You can go in and edit the care plan. Now, why is that? Like I said, most of the information is coming over from Athena. However, Athena doesn't have buckets for every single thing that's required under the Medicare regulations. So our system allows them to add that missing information. For example, there's no place to put goals for what they want their blood pressure to be. So let's say that we want it to be 120/80. We could set their BMI, their heart rate, and their weight goals. Anything with a gray background, obviously they can't touch. Anything with a white background, they can edit. Again, it's the same that we were just looking at. It's the medications. It's all of the counseling and risk reduction. This is what their plan is. What are they actually going to do to keep this patient healthy? What are their goals? What's the follow-up plan? All of that is captured right here in the care plan. Interventions I mentioned, these are anybody who you would need to call in an emergency, or anybody who needs, for example, this is for transportation, who to call. And then their care team, like I said, this is anybody outside your practice who needs access to this information. And then this is really the heart of the care plan. This is their chronic problem list, and this is condition by condition what it is that you're doing to keep them out of the hospital. It's a little tight in here, so we have a full screen edit mode. You pop that open, and now you can see that we're capturing all of their assessment and their prognosis, their symptoms management, what their goals and expectations are, and then whatever kind of follow-up there is. Down below here, we have qualitative questions. This is further detail about, in this case, diabetes. These are the types of questions that the practice might ask if they do an outreach program, essentially where they get on the phone, they call the patient, and they say, hey, I'm following up to find out how your care is going. Are you taking care of your dental needs? Are you doing your self-foot exam? Anything that has to do with this particular chronic condition is captured here. I'm going to cancel out of here. I didn't make any changes. If I did, it would be reflected in the care plan. And this is their acute problems. Here's their labs, which they don't have any. And then this is all the social history, all in gray, because that all comes over from Athena. If you were a practice and we were onboarding you, we do a full training. It usually takes us about an hour to get them trained. The whole process, the whole onboarding process, from the moment we get a signed contract to having them live, is less than a week. The first step, obviously, is to have them register with Athena to let them know that they are going to be working with us as MDP partners, and we get access to their table space. But from there, installing the software is a button click. Getting them set up and configured is a matter of a couple of hours. And depending on how quickly they do it, like I said, we can get them up and running easily in less than a week. So I'm going to close that. Now, if we had made any changes to the care plan, it would be reflected in there. In this case, I canceled out of everything. Now, you'll notice that the timer is still going. We're at 8 minutes. Now, I kept the timer going when we were in the care plan because all of that time counts. So even just going into the care plan and doing the review all counts towards the 20 minutes. Now, I'm going to stop because I'd like to show you another section of our program, but all of that time, that 8 minutes and whatever seconds, is all being saved, and I'm going to show you that right now in our reporting system. So if I come over here and I go into Tools and I go into Reports, This is our dashboard. It goes out and it lets the practice take a look at how they're doing, how their CCM program is doing at a overall level. So this is telling us that there are 86 patients here who haven't received any minutes of CCM time yet this month. We've got 13 who are somewhere in that 1 to 19 minutes. We have one patient who, no surprise, is going to be our Susan Doe, who is 20 minutes to 59 minutes, and then 60 to 89, and then 90 or more. So if I click on this the 13 patients here, you can see that across the board, these are our patients, our test patients, and they've got all sorts of time. So they're anywhere from 2 minutes, even 4 seconds here, up to, what's the highest, 4 minutes. If I go back to here, so that was our 1 to 19. If we go back to here, you'll see Susan Doe, who's the test patient that I was showing you. If I double click on this, I can actually get more detail. So now you can see that we were in just now today for 8 minutes and 19 seconds. These are the buttons that I clicked earlier: order meds, review labs, and do a care plan review. So this is the type of reporting that's available to the practice. They can take a look at whatever detail they need to. And this is also where they might go should they be audited. An auditor comes in and says, prove to me that in March of 2017, you gave 20 minutes or more care to Susan Doe. You could pull this report up and show them, yep, this is exactly who logged the time, the date and the time, and down to the second how much time they spent. And again, this is all captured automatically. I didn't have to do anything. I didn't have to push any buttons. I didn't have to toggle over anywhere. It was just all done while I was in the patient's chart. Everything, I didn't point this out, everything can be exported to Excel, so if you do need to email this information to an auditor, that's also available. We have other functionality in here. I won't spend too much time. You can add time. Perfect case is doctor has an on-call service. He gets a phone call at home. He has to call the patient, etc. Another example where they have to edit time. Let's say the doctor realizes that she was reviewing the care plan but got distracted, stepped away for a little while, and needs to come back and change some numbers. Maybe this wasn't 15 minutes. Maybe this was more like 5 minutes. So she can come in here and change this to 5 minutes and save that. So again, just a bunch of functionality to make sure that you're capturing the right time so that at the end of the month, when you go to bill Medicare, you have all accurate data captured for you. So that's it for reporting. We have a whole bunch of customization tools if they want. They can come in here. This is where they would add people to their practice. You can define different roles. For example, you might have, and this goes to the checkboxes on the timer. So you might have a different grouping of checkboxes for your provider. You may have a different set of checkboxes for your supporting staff, etc. And you can set up as many roles as you'd like. And then you can come in here and you could add users. And these are all Athena users. It's single sign-on, so you don't even have to sign into our system. But they're all listed here. You can assign them to whatever role you want them to, and you could capture other information. And then there's a whole bunch of other stuff on here that you can customize. Again, this isn't a training class. This is really just to give you an overview of how our system works. And then finally, we have our tasking tool. Now this gets a little bit involved. This is certainly above and beyond what I want to cover on this. But what this is, it's a tool that allows you to control who is calling what patients. If you have an outreach program and you want to manage it, you can assign different patients to different staff members and put them on a rotation so that they're calling each one of these patients on a scheduled time, or you might set it up so that you call them. So this one here, last office visit, show patients 3 days after a visit with their usual provider. So that if you were using this tasking tool and you logged into the system, it would pop up and anybody who was in 3 days ago would appear on your list. Again, outside the scope of what I wanted to cover here. But the last piece I want to talk about is billing. So at the end of the month, our system does all the back office work for the practice. We go out, we figure out exactly who was over 20 minutes, and we generate and drop the claim on their behalf. We drop it right through Athena, so it processes through just like their regular billing does. It goes off to the payer, and the practice gets reimbursed. And finally, let me talk about how much it costs to use our software. We use the same model that Athena uses. It's essentially a percentage of the revenue that they're producing. So we bill roughly $8 per patient per month. So of the $42, approximately 20% comes to us as part of the CCM program. There's no other fees. There's no fees to get started. There's no fees to exit. There's no monthly fees, nothing. It's literally just based on the number of patients that they are able to claim through CCM to the payer. And that's it. That is our program. I appreciate your time today. I appreciate you taking the time to learn about our product. I hope you see that we are very, very different from our competitors. We do offer a unique solution that is built right into Athena. It eliminates a lot of that non-value added work of toggling in between and calling up different patients and having to rekey and check to make sure that they're enrolled or not enrolled. All of that is done for you. Easy and convenient. That's our goal. Appreciate your time again. I'm Mike Rubin, and if you have any questions, please email me. My address is mrubin, Rubin, at dulcianhealth.com. Thanks.